A new viral threat understanding human metapneumovirus. Human metapneumovirus, or HMPV, is a respiratory virus that is increasingly recognized as a significant cause of respiratory illness worldwide. First discovered in 2001, HMPV has rapidly emerged as a common cause of colds, bronchiolitis, and pneumonia, particularly in young children and older adults. HMPV is a highly contagious virus that spreads easily through respiratory droplets, posing a significant public health concern. HMPV belongs to the family, which also includes the respiratory syncytial virus, or RSV. Both viruses share similar characteristics, including their structure, mode of transmission, and the populations they typically affect. HMPV infects the cells lining the respiratory tract, causing inflammation and swelling that can obstruct airflow and lead to difficulty breathing. The emergence of HMPV as a major respiratory pathogen highlights the need for increased awareness and understanding of this often overlooked virus. While HMPV can cause mild cold-like symptoms in many people, it can lead to serious complications, especially in vulnerable populations. By learning about the virus, its transmission, and prevention strategies, we can take proactive steps to protect ourselves and our loved ones from this emerging health threat. Unmasking the culprit symptoms and transmission of HMPV. Human metapneumovirus, or HMPV, typically presents with symptoms similar to those of the common cold, making it challenging to diagnose based on symptoms alone. The incubation period, or the time between exposure and the onset of symptoms, is typically 3 to 6 days. Common symptoms include a runny nose, cough, sore throat, and fever. In more severe cases, HMPV can lead to bronchiolitis, an inflammation of the small airways in the lungs, or pneumonia, an infection of the lungs. These conditions can cause difficulty breathing, wheezing, and chest pain, particularly in infants and young children. Older adults and individuals with weakened immune systems may also experience more severe symptoms. HMPV is highly contagious and spreads primarily through respiratory droplets produced when an infected person coughs or sneezes. These droplets can travel up to 6 feet and infect others if they come into contact with the nose, mouth, or eyes. The virus can also spread through direct contact with contaminated surfaces, such as toys, doorknobs, and countertops. Good hygiene practices are crucial in preventing the spread of HMPV. Regular hand washing with soap and water for at least 20 seconds, especially after coughing or sneezing and before eating, is essential. If soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol can be used. Covering coughs and sneezes with a tissue or the crook of the elbow can help prevent the spread of respiratory droplets. Shielding ourselves. Prevention and treatment of HMPV. Preventing the spread of HMPV relies heavily on adopting good hygiene practices and taking precautions, especially during peak viral seasons. Regular hand washing with soap and water for at least 20 seconds remains the cornerstone of prevention. When soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol are a suitable alternative. Avoiding close contact with individuals who are sick, especially those exhibiting respiratory symptoms, can significantly reduce the risk of infection. Disinfecting frequently touched surfaces, such as toys, doorknobs, and countertops, with household disinfectants can help eliminate the virus from the environment. Maintaining a healthy lifestyle by eating a balanced diet, exercising regularly, and getting enough sleep can strengthen the immune system and reduce the likelihood of infection. Currently, there is no specific antiviral treatment for HMPV. Management of HMPV infection primarily focuses on relieving symptoms and providing supportive care. Over-the-counter pain relievers and fever reducers, such as acetaminophen or ibuprofen, can help alleviate fever and discomfort. Adequate fluid intake is crucial to prevent dehydration, especially in individuals with fever or those experiencing vomiting or diarrhea. In severe cases, hospitalization may be necessary to provide respiratory support, such as oxygen therapy or mechanical ventilation. While research is ongoing to develop vaccines and antiviral treatments for HMPV, preventive measures and supportive care remain the mainstay of managing this emerging respiratory virus. Staying ahead of the curve. Research and vigilance. As HMPV continues to pose a significant public health threat, research efforts are underway to develop effective vaccines and antiviral treatments. Scientists are exploring various vaccine approaches, including live attenuated vaccines, inactivated vaccines, and protein subunit vaccines. These vaccines aim to stimulate the body's immune system to produce antibodies that can neutralize the virus and prevent infection. Antiviral drugs that target specific viral proteins involved in HMPV replication are also under investigation. These drugs could potentially shorten the duration of illness and reduce the severity of symptoms. However, developing effective antiviral treatments for respiratory viruses like HMPV has proven challenging due to the rapid mutation rate of these viruses. Staying informed about HMPV and following recommended preventive measures is crucial in protecting ourselves and our communities. Public health organizations such as the Centers for Disease Control and Prevention, or CDC, and the World Health Organization, or WHO, provide up-to-date information on HMPV, including its epidemiology, symptoms, transmission, and prevention strategies. By staying vigilant, adopting healthy habits, and supporting ongoing research efforts, we can collectively combat the threat of HMPV and other emerging infectious diseases.